I had lunch with one of the local vascular surgeons the other day. He had just heard that I had opened up my own clinic, so wanted to support, encourage, and obviously eventually for me to send referrals his way. But he just got lunch for the clinic, invited me over to talk. He he was impressed in this state that people are still opening up their own practices because it seems like a lot of people who have had their independent practice are shutting down, and there's a lot of talk about the climate not being the best for people who are wanting to start their own practice. So he just wanted to encourage me. He gave me the story back when he started. Actually started as a cardiologist first, an interventional cardiologist. And just out of necessity, there was a patient who came in with lower leg pain. They were going to poor circulation. They're going to amputate his one of his feet, and they were just asking him if he can do something. So at that time, vascular surgeon wasn't surgery, especially in the lower extremities, wasn't that common. But he just said, "Let me just try and see if I can do a balloon angioplasty on this," and he did. The patient's circulation improved, saved the amputation. So then he said, let me just start doing more of this, and ended up getting board certified in vascular and then later in wound care. So he just talked about the grind early on, and even with him when he came to the city as an interventional cardiologist, a lot of the places he went, they didn't want to hire him, stated that the market was oversaturated. But so he just ended up opening up his own thing, and slowly but surely he got patients. Obviously, it's a different scenario than I'm at. I don't have the skill of being able to do a specialized procedure, which helps a lot. So my buildup has been a lot slower. But I think the word is getting out there slowly and surely. Right now, I've been thinking about. So I work at another clinic. I'm doing the other clinic currently. Well, I started off doing Monday, Wednesday, Friday full days, Tuesday, Thursday, just in the evening, and I was just at this clinic, my clinic, in Tuesday, Thursday mornings. Now I'm doing full days, Tuesday, Thursday. Most days since I've done the full schedule, it's just been. Last week was the first week, and it's been about 20 patients. 20 patients on the schedule. Let me see, and then seeing 16 patients seen. So it's not optimal, but increasing. And to think, I'm still waiting on some of the major contracts here in the area. Ultimately, yeah, I probably really got going in mid-March, early April. I had some contracts, so just about a little bit over that 3-month mark. Honestly, I thought I would be busier than I am now. I thought things would pick up a little bit quicker. It's been slow with reimbursements, except Blue Cross. Blue Cross has been paying very quickly. I've been seeing a lot of people pro bono that I've patients in the past who wanted to follow. I just kept seeing them, whether I accepted their insurance or not. Hopefully it goes through and I'll be able to bill for them. But I just wanted to continue that care for now. And actually, there was one patient who called, said that they had spoke with me. They went to the urgent care. She was a train wreck. They said, "Oh, go see Dr. McGill. He's the best." Anytime they say that, they're always sending over a train wreck. But anyway, she told them that her partner had told the front staff that he had talked to me already, and I okayed it. That was not the case. So I saw her pro bono. She had already came in, and very needy patient, but with a huge wound with a tendon exposed. So hopefully they'll be able to save that limb. So just sent her over to vascular. But I'm looking forward to get another job. My income is just not cutting it. the reimbursement's low. I'm looking either for urgent care or prison that I can do on the weekends while I just grow Maverick Tuesday, Wednesday, Thursday. I've also been applying to a lot of telemedicine jobs. So just want to fill in that income. So that's where I'm at now.